This is my second full knee replacement surgery. I had my left knee done almost 3 years ago.
Judy actually had her left knee replaced in 2014, and she was very, very happy with that process. So what she noticed after having the left knee done is actually she couldn't believe how bad her right knee was.
It's really bothering. It's at the point where it interferes with my walking and my daily routine. I used to take my dog out for walks, but I couldn't do it because of the knee.
She's very active in Zumba. She likes to dance, very active with her husband, Tony. And so they kind of made a joint decision with myself to kind of say, you know what, I'm ready and I want to get this done.
We certainly do collaborate with the primary care physicians, and it's nice here at the Social Medical Center that we have the primary cares in-house. What I typically tell patients is that you'll know when it's time. I say when the joint takes over your life, that's when it's really time to think about having the surgery.
Really, I'm here for you. Once a patient decides to have surgery, part of their preparation is that they attend the joint replacement class that we offer here at the hospital. The joint replacement class is where I tend to meet all the patients for the first time. And really what we do at the class is we walk them through the process.
Leading up to the surgery, depending on the patients, we always check with the patient to see if they have medical issues. They have a consultation with the anesthesiologist. They have what's called a medical clearance to have the surgery. They get educated on what's going to happen before the surgery, after the surgery, shown that people actually do better with going to the class, that they're more satisfied with the outcome, there's less anxiety about the whole procedure.
Probably my favorite part of the job is being in the operating room. It's an exciting place to be. There's so much going on, and I really feel that being a part of that technical aspect of helping patients get better is probably my favorite part of the job.
Currently, we've been doing many more of the surgeries under a spinal anesthetic, which leads to less anesthetic. There's less nausea afterwards. People tend to be recovering quicker with the spinal.
I actually was fortunate to have met Judy during her first total joint replacement. So probably the best predictor of the future is the past, and she did really well with that first total knee replacement.
I remember starting and someone having a joint replacement surgery, whether it was a hip or a knee or a shoulder. They stayed for like a week, sometimes more, and then they all went to a rehab facility.
Being in practice for 16 years, things have definitely changed. It has more to do with how we're treating people afterwards. People don't have to stay in the hospital for 5 to 6 days afterwards.
Hey Judy, how are you doing?
Once these patients come up to Emerson 5, we're looking to get them up and start walking. And our really big initiative is early mobility. And by early mobility, it's out of bed the day of surgery. Following morning, it's in the chair for all your meals. It's walking in the hallway with us at least 3 times a day. We have a nice rehab gym in the middle of our floor where patients get down there twice a day to do exercising. We really encourage patients to return back home with the visiting nurses services, so having the nurse, the physical therapist, the occupational therapist come into the home to help them rehab, and then everybody eventually gets to outpatient therapy. So that's kind of the third stop in their recovery phase, where they go to an outpatient physical therapy clinic to really work on that muscle strengthening, getting the best range of motion out of their new joint replacement.
Judy's main goals are to get back to walking 1 to 2 miles during the week and get back to dancing. So I don't have any issues or feelings that Judy won't accomplish those goals. Judy's just super motivated and she's just been a joy to work with. So that's what makes it really easy, and you get a patient that wants to get better and has specific goals that they want to achieve. And you know, that's almost like the perfect candidate of a person, and I feel like Judy is that when she comes into physical therapy.
So a lot of times our patients who come in and have a joint replacement and recover, just getting back to walking every day, getting back to golfing, dancing, gardening, going swimming, are really kind of the rewarding things that patients like to do.
To me, the quality of your life is almost more important than the length of your life, and if you can't do the things that you need to do, that you want to do, then that really impacts your overall happiness.
I planned a trip to Palermo, Sicily, in July of 2018, and I know if I didn't have this done, I would not be able to do the walking I need.
The satisfactions of doing what I do is seeing people come into the office, they're in pain, they're limited in their ability to sometimes even go up and down the stairs or drive or get out of bed, and to have the technical ability to replace their hip or their knee and give them back the function of daily life.
If I had known, I probably would have had it done sooner. I wouldn't have waited as long. You got to do it because you've got to go on and stay active, stay alive. I mean, live.